There's a whooping cough epidemic in Tasmania right now, and it's expected to worsen over the next 6 months. We spoke to Tasmania's Public Health Director Mark Veach to get the latest on the illness and rates of infection in Tasmania. Whooping cough is a highly contagious bacterial infection that starts with cold symptoms before developing into a persistent and distressing cough. Case numbers reach epidemic levels every 4 or 5 years when there's a build-up of people with no or low immunity. And that's what's happening right now, with 300 cases reported in Tasmania so far this year. By contrast, there were just 12 cases in 2023. Most of those cases have been in the south, but they're beginning to also pop up in the north. And it's not just in Tasmania. The epidemic is around the country. Babies are most at risk because they can't be immunised until they're 6 weeks old, and their lungs are more vulnerable. Fortunately, none of Tasmania's cases this year have been under 6 months old. The majority of infections are in children though, late primary and early high school kids. Vaccinations against whooping cough are available. The first priority is pregnant women. Next, babies over 6 weeks old. Both groups can be vaccinated for free. Anyone who spends time with babies, like relatives, healthcare workers and childcare workers, should be immunised every 10 years. And if you're infected, make sure you tell anyone you've seen who could be at risk.